Hello everyone, welcome to my channel Health 365. 6 medications that might heighten your risk of a heart attack. Are the drugs you consume daily quietly elevating your chances of heart attack? In this vital discussion, we'll unveil 6 commonly used medications that could be compromising your heart health without you even realizing it. Recognizing these hidden dangers is crucial for making well-informed choices about your well-being. If you are dedicated to protecting your health, make sure to subscribe to Health 365 and click the notification bell. Doing so will ensure you stay informed with our latest insights and guidance to help keep your heart in prime condition. 1. Hormonal contraceptives. Hormonal contraceptives have played a significant role in providing women with effective family planning and reproductive control. However, their usage has been linked to different levels of cardiovascular risk. Awareness of these risks is essential for making educated choices regarding contraceptive methods. Combined hormonal contraceptives, CHCs, which consist of both estrogen and progestin, come in multiple forms such as pills, patches, and vaginal rings. Studies reveal that CHCs can elevate the risk of arterial thrombotic events, including myocardial infarction, heart attack, and ischemic stroke. A broad study covering over 2 million Danish women aged 15 to 49 found that users of estrogen-progestin combination pills faced a twofold increase in the likelihood of these events. Specifically, this equates to 1 additional stroke per 4,760 women and 1 extra heart attack per 10,000 women each year. Interestingly, non-oral CHCs were linked to even greater risks. For example, vaginal rings were associated with a 3.8-fold rise in heart attack risk. The underlying cause is believed to be estrogen's impact on coagulation pathways, creating a prothrombotic state. Estrogen can enhance the production of clotting factors, increasing the probability of clot formation. This risk is particularly concerning for women who have additional risk factors such as smoking, high blood pressure, or high cholesterol. On the other hand, progestin-only contraceptives, including pills, injections, implants, and intrauterine devices, IUDs, generally exhibit a lower cardiovascular risk than CHCs. The same Danish study indicated that progestin-only methods had a slightly increased risk, but significantly less so than estrogen-containing contraceptives. Notably, the progestin-only IUD did not show any heightened risk of heart attack or stroke, making it a safer option for women worried about cardiovascular issues. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs, NSAIDs, are extensively used to alleviate pain, lower inflammation, and reduce fevers. Popular over-the-counter NSAIDs include ibuprofen and naproxen. While effective, these drugs have been associated with a heightened risk of cardiovascular incidents, including heart attacks and strokes. NSAIDs function by inhibiting cyclooxygenase (COX) enzymes, specifically COX-1 and COX-2, which are integral to the production of prostaglandins, lipid compounds that help regulate inflammation and maintain other physiological functions. Suppression of these enzymes can disturb the equilibrium between vasoconstriction and vasodilation, as well as platelet aggregation, potentially leading to an increased likelihood of clot formation. Numerous studies have emphasized the cardiovascular dangers linked to NSAID use. The U.S. Food and Drug Administration, FDA, has stated that the risk of a heart attack or stroke can arise within the first few weeks of NSAID use, and this danger may escalate with prolonged use or higher dosages. Importantly, this applies to both prescription and over-the-counter NSAIDs. A comprehensive review published in the European Cardiology Review examined the cardiovascular implications of traditional NSAIDs and COX-2 inhibitors, COXIBs. The analysis highlighted that NSAID-related cardiovascular risks had been underestimated for many years. Some NSAIDs present greater cardiovascular hazards than others. For instance, diclofenac has been linked to a significantly higher risk of major vascular events, including heart attacks. In contrast, naproxen appears to have a more favorable cardiovascular safety profile. Given these potential risks, it is vital to use NSAIDs judiciously. Before starting NSAID therapy, consider the patient's cardiovascular history and risk factors. Prescribe the lowest effective dose for the shortest duration necessary to alleviate symptoms. Patients with a high cardiovascular risk should explore alternative pain management methods that pose less danger.